So this is a frontal lobe, an parietal lobe, temporal lobe, and the occipital lobes. This is a cerebellum, and we have the brainstem over here. And this is a, lateral fissure, and this is called a Sylvian fissure. So that was a coronal section, and when we take a section, this is what we are seing. We have, and this is an anterior view basically. So we start with the lateral ventricles, which opens up into the foramen of Monro and reaches the third ventricle. And then we go down through the cerebral aqueduct and we get fourth ventricle, and which then continues as the central canal of the spinal cord. Once you know this flow of the CSF and the ventricles in the brain, this will help you in a better way to understand when we go and do our cranial ultrasounds. So in a sagittal view, this is how the ventricles are seen. These are the lateral ventricles, anterior horn, the posterior horns, and the temporal horns. And this is a foramen of Monro. We open up like this, and we reach the third ventricle. And then through the cerebral aqueduct, we reach the fourth ventricle, and then to the spinal cord. So how the basal ganglia, thalamus and all look? In a coronal section, this is a lateral ventricle. Here is the caudate, here is the thalamus and the putamen and globus pallidus. And below this comes a third ventricle.